My name is Stephanie Williams. I live in Harrisburg, Pennsylvania. I live here with my husband and our daughter. She'll be starting third grade pretty soon. She's 9 years old. And my husband and I are originally from Ohio, so we moved out here to Pennsylvania around 2014, and we've been here since then. The spring of 2021 was an interesting time because we were starting to see the light after, the pandemic had been weighing so heavy on everybody. And my daughter was about 5 years old, and she was also kind of coming into her own. We were doing more things together. And that summer, I remember just being so much fun because she was going to start kindergarten in the fall. And we were really living it up and enjoying not being on anyone's schedule, like a school. So something else that was going on that summer, was a persistent cough. I had noticed a cough in spring of 2021, and it was so mild and somewhat intermittent. So I always brushed it off. I would mention it. And as the months went by, I would kind of say, I feel kind of wheezy. I don't know what it is. It must be allergies. And I would attribute it to humidity or the pollen count in the air that day. Um, Eventually, I had a regularly scheduled doctor's appointment roll around. And at that appointment, it was like a yearly visit with my general practitioner. I brought up this cough, and she said, well, it could be a couple things. It could be acid reflux. We could try a medication for that, see if it goes away. We can try an allergy medication, see if it's allergy related asthma type stuff, see if that helps. And I said, can we just get a chest x-ray? Because like I said, the pandemic was still kind of, happening around us. And I thought, who knows, maybe I had an asymptomatic case and here I am with some residual effects. And fortunately, she said, sure, you want an x-ray? Let's go down the hall. We'll take an x-ray right now. She called me the next morning and let me know that a mass was seen on that x-ray. It's interesting because I had seen it myself when the x-ray tech took the first image. She then had me turn to the side for the second image. And as she was loading that up, I could see on her computer monitor my first image that took. And I saw like a cloudy oval on my right side. And I kind of thought, well, that's odd. That's so strange to me that I didn't really even process it. But that night at dinner, I mentioned to my husband, I saw like a mass on the x-ray when the tech took the image. And he said, what do you mean a mass? And I kind of said, well, I don't know. It was odd. And then we just kind of went about our dinner because it made that little sense that we didn't entertain it with a conversation. And like I mentioned, the next morning, my doctor called and told me the x-ray was abnormal and had me get a CT scan later that day. The CT scan was ordered stat, and she told me it was going to be a hold and read, which means I stay there at the facility until the CT is read. I don't leave. And I had the CT done, and that's when I starting to feel like, okay, this is something pretty serious, something pretty wrong. When they want you to get imaging that quickly, and they don't even want you to leave the hospital where the imaging is being taken until they know what's going on. I got a call from my doctor while I was sitting in the waiting room waiting for the results. They must have called her with them before coming out to talk to me. Anyway, she told me that the mass was large, and she told me it was spiculated, which means there were, kind of spiky things sticking out of it, which I was an RN before I had my daughter. I stopped working to stay home with her, 9 years ago. But even though I never worked in oncology, I know that whenever there's something in your body, you want it to be smooth with really nice borders. You never want it to be spiky or stretched out looking or, irregular looking. So right away when she said spiculated, that was kind of my oh no moment. And then, further down on the report, she was reading it to me. It said highly suspicious for neoplasm. So that's when I kind of knew we're probably dealing with some kind of cancer. I Came home that night. My in-laws were over. My husband and my daughter were, finishing up their pizza that they had had with my in-laws. And I just remember I called them on the way home. I told my husband what happened. I cried a little bit. And I came home and I was sitting in the dining room just like eating this like cold pizza crust, trying to let it all sink in while they were kind of all in the other room sort of whispering. And, my husband was kind of telling his in-laws what was going on while trying to be sensitive to me, who's like sitting there, but I can't talk about it because I'll cry. And, it felt very surreal for me to be like sitting at the table, kind of watching my family try to understand what might be going on. The surgeon called and was able to schedule me for a biopsy within probably 2 weeks of that initial chest x-ray. And that was kind of, I feel like, a quiet period. I think I got some blood work in that time. I can't remember if I got more imaging yet at that point. The biopsy was a bronchoscopy. They went, down my throat and took a piece of a couple of the lymph nodes nearby and the tumor itself. And I woke up, with a sore throat, but other than that, not really any worse for the wear. At this point, I was still checking the portal every day for results of, blood work and then results for the biopsy. And they kind of came trickling in because they sent the specimen out to be tested for everything. Could it be fungal, bacterial, cancer? So, things were coming back okay, negative for this random fungus they checked for, okay, negative for these bacteriums. And I was like, well, maybe this is just a really odd focal organizing pneumonia. Maybe it's just a pneumonia that just looks really weird. But then I think it was just a couple of days later, he called, the surgeon called me. And, I always say it sounded like he was in the car. And I don't mean to paint the surgeon in a light that he was being overly casual about something so serious. I really believe he called me because it was the first chance he had to call me, and he wanted to call me immediately to get this rolling. I don't think he wanted to wait for an appointment or to be at his desk. I think he just wanted to get the call through. So he said, it's positive, it's cancer, and this is what we're going to need to do. PET scan, brain MRI, pulmonary function test, echocardiogram, all these things. And I'm going to take this to the tumor board at our hospital, and we're going to talk about your case. And I'm thinking we're going to take it out, but, I'll discuss this on Thursday with tumor board and we'll make the determination then. So before he hung up the phone, I was like, well, wait a minute, what kind of cancer? And he said adenocarcinoma. And then that was that. So after that, it was just, all those tests that I mentioned. And that's when I knew I had cancer, when he called and told me and said it was an adenocarcinoma. We must have had another like telehealth visit where he said, okay, I've discussed this with tumor board. We're going to do a lobectomy, which is where they take out a lobe of your lung. And he said, due to the size of the tumor, it was like 5 centimeters. He didn't think he would be able to do it via VATS, which is the video assisted thoracic surgery, like the minimally invasive, kind of like a laparoscopic way where they use the robots and all that. He said, I'm probably going to have to open you up and do like the old fashioned thoracotomy, the open thoracotomy. So I was kind of already prepared that this was going to be a pretty major surgery. My mom drove me to the hospital really early that morning. She had come in from Ohio and was planning on staying for a while. So the last thing I remember is, kind of being bent forward, having that epidural placed, and then being laid down on my side. And when I woke up, I was in a lot of pain in my shoulder, which I assume is just because of the position they had my arm in for those hours that the surgery was being done. They gave me like a fentanyl patch on that shoulder to help. And I was in ICU, and my mom was there. The nurse was there when I was waking up. And my mom told me they took two lobes, they took your middle lobe too. And I was kind of, that was a surprise to wake up and learn, okay, there's two lobes gone, not one. Later, the surgeon would explain the tumor was kind of almost between the two lobes, and like he said, it was almost like a unilobe. So rather than risk leaving some behind, trying to just take one lobe, he just took them both. The hospital stay, it sucked. I'll say that. I mean, it was just, there's a chest tube. You're constipated from all the anesthesia. I had a Foley catheter in because I had an epidural. And it was just, I felt like a one-man band with like an IV pole here, a chest tube here, like the catheter there, the heart monitors, like kind of, like Frankenstein's monster in a way. But slowly those things were discontinued. Eventually, the chest tube came out after a day or so. But that epidural, my bladder was offline. My bladder logged off and was like taking PTO somewhere else. It took me forever to be able to like pee on my own again. So that was like a whole debacle. Such, to the point where the surgeon came in with the pathology results and was saying, okay, well, I have some great news here. All of the lymph nodes, they took out a dozen lymph nodes, all of them were negative for any cancer in those lymph nodes. We got clean margins. There was no visceral pleural invasion, no vascular invasion. And I'm like, yeah, about my bladder. I can't pee. What are we doing about this? I mean, of course, once I understood the gravity of what he was explaining, that the cancer was seemingly contained to just what he took out, and that, I was stage 2. It was after that surgery I was officially stage 2B. And I think until they got in there and tested all those lymph nodes and saw what they were working with, they hadn't officially staged me. And I think he presumed, okay, you're probably maybe like a stage 3, assuming we have a positive lymph node or two. But fortunately, stage 2B. It was about a month after my surgery, I met with an oncologist for the first time that the surgeon had referred me to. And he came in the room and said, "You're ALK-positive." And that was the first I had heard of my genetic mutation. ALK-positive is it's a biomarker or a genetic mutation that is inside the cells of my tumor. So it's only in the tumor. It's not, if you drew blood on me or if you took a biopsy of my leg, there would be no ALK-positive cells in there. It's something that happened in one cell initially in my lung, and for whatever reason that proliferated and kept replicating, growing into a tumor. There's a lot of biomarkers. There's EGFR, ROS1, KRAS. I mean, and then that's just the lung cancer ones that I know off the top of my head. But ALK-positive is one that responds to targeted therapy. It affects, I think it's like 4% of lung cancer patients. It affects mainly people with no smoking history and people who are younger than your typical lung cancer patient. It affects people in their 30s and 40s and 50s instead of, 70s, 80s. Not that it can't affect that age group, but we see a different sort of trend. They mentioned to me that you're probably going to need a little bit of chemotherapy. And maybe I'm adding the little bit in there. Maybe they didn't say little bit. Maybe they just said chemotherapy. But in my mind, I thought, well, since surgery was successful, I'm just going to get a little sprinkle of chemo. I'm going to get diet chemo, light chemo. Like, I had myself like, I'm not getting chemo. That's for people with cancer. I'm getting, this other thing, which I got 4 rounds of, a pretty hefty chemo. Initially, I got a port. I had a port placed to kind of save my veins from the harsh chemo. And that was how I got my chemo. The first treatment I got, I did have a reaction of some kind to, I think it was one of the anti-nausea meds, actually. It wasn't like the chemo hadn't even, started yet. And I started coughing, and I just kind of felt like this throat closing up sensation, and it was so terrifying. And it left me so rattled. And I think that kind of opened a little bit of an emotional floodgate where I was already like barely holding it together, that I had to be in this place getting this like really scary medication, fearful of cancer, still healing from my surgery. And then that happened, and I just really broke down a little bit. I was okay, it passed, and the nurses were great and everything, and they never gave me that medication again. Beyond that, it was a long day. There was a ton of fluids that ran with all of those medications, so I left feeling like my eyeballs were swimming in their sockets. I just felt so full of fluid. They stuck a little patient or like medication delivery device on my belly before I left that was going to inject another medication a few hours later, like automatically, to stimulate like white blood cells or something. So it was just a really long day, and I felt super, super fatigued for like 5 days or so afterwards. My ears were ringing. I felt very foggy. If I looked up into the sky or at like a white wall, I saw a lot of like, I wouldn't say floaters, but just like kind of soupy vision. Just a lot of weird oddball things that are kind of scary because I never had them before. And I was sad that I was going to have to do it 3 more times after that first one, but I did them. After chemo, this is where it gets a little unconventional. I had since sought, between surgery and chemo, I had sought a second opinion from an ALK expert, or a doctor highly experienced in treating ALK patients, at a major medical center. And that doctor said, hey, usually targeted therapy is only used in stage 4 patients. It's designed to keep their cancer at bay, stop it from spreading. It only works for a certain period of time. Cancer gets smart, mutates around. But anyway, we have this medication, and it's usually reserved for stage 4 patients. But there's clinical trials being done, and there's new data coming out that it may have a benefit in earlier stage patients, because even though you've had surgery and you've had chemo, it could come back. Maybe it never will, but there's a chance that it can, even though everything looks great right now. And he suggested that I take this targeted therapy. He said, take it maybe for 3 years, because we don't really have data to advise us really on how best to do this. But he said he thinks this data is coming that's going to show that it is beneficial. So that's what I decided to do. My local oncologist had suggested a clinical trial that would give me access potentially to a first generation targeted therapy for ALK. But my second opinion doctor was like, we have better drugs now. There's second generation, third generation TKIs, they're called, tyrosine kinase inhibitors, that they protect the brain better. They're just all around a superior medication. So I wouldn't bother with that clinical trial. Let's just try to get you this good TKI, this targeted therapy. So I took that information back to my local oncologist. He agreed with that. And we sent off the paperwork to get that targeted therapy. And fortunately, it was approved. And I've been taking that now since about a month after chemo ended. I started that medication. It's been about 3 years since my diagnosis. And I've had all clean scans. I've had great blood work. I haven't had anything pop up. But since I'm only, not even 3 years yet, I don't know quite how to, like, I won't say that I'm cured, because I just don't feel comfortable in that. I don't, I'm still taking these pills every day, praying that it never comes back. So I almost don't want to tempt fate and say like, oh yeah, I beat cancer, because I don't know if I beat cancer yet. I hope I did. I hope this never comes back. The plan, like I said, was to take those pills for 3 years. It's been about 2. Um, and at my last appointment, the doctor was like, well, if you're tolerating them, maybe we'll just keep you on them. So, I mean, we'll see when that 3-year mark rolls around. But, I have a child that I really, really don't want to leave motherless. So if there's something that I could be doing to increase my odds that I won't die while she's in her childhood, I'm going to do that. So that's why I'm taking this targeted therapy. She's an only child, and she needs her mom. And my husband's great and we have great family, but she needs her mom. And I'll do whatever I can to be here until she's an adult. So that's my why. And, before my diagnosis and treatment, I used to say, when I heard, I would say to myself, if I heard that someone was not doing chemo and choosing instead to, go on hospice or something like that, I would kind of think to myself, wow, I can't imagine ever not just doing everything. I could never imagine accepting a terminal diagnosis and not fighting it. But I'll tell you, during chemotherapy, feeling what it was doing to my body and feeling like the life had been sucked out of me, I totally understood how some people would be like, I'm not doing this. I'm not putting myself through this. And, I didn't get there because I have a family and I have a young daughter that I just can't leave. But I get it. I get how cancer and its treatment can have you rethink just exactly what you're willing to endure, and to what end. My advice would be to find out your biomarker if you don't know it yet. And once you have that information, get a second opinion from an expert in that biomarker. Look up who's doing research right now on EGFR or KRAS, who just gave a speech at a lung cancer conference about ALK. Look them up, find their email, or better yet, join a support group like ALK-positive or EGFR resistors or the ROS wonders, because the people in that group can help you find that information. They know who the expert doctors are because they've kind of been in the game for a while. So know your biomarker, seek a second opinion, and find a support group.